All right, Jason Rosen back here with Robbie Besner, continue to discuss the light beds. So one we talked about earlier was our narrowband UVB bed. This one is our far infrared bed. So all these light bulbs produce far infrared. I should mention these are prototypes. The ultimate goal is to create one bed that has all the different frequencies in one device. So we'll chat about that. I'll have you chat a little bit about more of that on later. But so this bed is strictly far infrared, and being that you're laying in it at such a high amount of frequency, it penetrates even deeper than a sauna, from what I understand, Robbie. So if you could just, again, comment on, how would I use this as a clinician, and some of the other benefits, other than the fact that it looks really cool.
Well, throughout the years, Therasage has always held itself out to be specialists in infrared. So I have a particularly great passion for this product and this particular format, because I'm delivering infrared frequency almost directly into the cell. So as we discussed earlier, the UV frequencies are nurturing, but the IR, the infrared frequencies, are the healing frequencies of the body. That's going to stimulate all of the major circulatory issues. It's going to revive tissues. It's going to heal the cells. It's just amazing what infrared will do. And the best format to get infrared in is the way nature intended it to be, through a wavelength, through a sunlight wavelength, through light. And so what we've created here is a way to infuse the light directly through your melanocytes into the cells. We're focusing on particularly on special infrared frequency bands. And when you bring it close to yourself in this format, it's really going to deliver the best therapy you can get. So if you're coming to us with any kind of pain, if you have circulatory issues, regulating blood pressure, changing your pH of your body, this is the bed to do it. And boy, it's just amazing. We've seen transformations in short periods of time, maybe 1 or 2 treatments. People are in extreme pain, they come out of pain, and it's a really great way to jumpstart any protocol that you might be offering in the clinic.
Absolutely, and good for your sickest patient all the way to your maintenance patient, a hands-free, hands-off treatment for the doctor. I know one of the things that really stuck out to me that you're talking about, some of the clinicals you're doing, is not only are people getting out of chronic pain, but pH, you said people in pHs are going from like 4, the typical acidic American on the standard American diet, properly acronymed SAD, and they are getting their vitamin D levels, coming in at like 18, pH going up to like 7, 7.5 in like a week just from light, no supplementation on urine and saliva, and then their vitamin D levels are going from like 18 up to 70, 80 in a week. And we know that that chronic patient's going to need to come in quite a few times to start. But then after that, when you're in maintenance, you come in once, twice a month. You might want to come in more because it feels so good. But just that keeps you maintain that pH, maintain that D level, and man, what a defense against talk about preventative medicine. So
Jason, in clinic, no matter what you're doing, when the doctor caps off their therapy by saying go hop on the light beds, every single patient comes out with this big smile on their face.
True.
They're just so happy. They're feeling so great. And it just gives us such a great feeling, like for hardly any expense, additive expense to their treatment plan, they're getting such a great result. It really is amazing. So we're very pleased in the direction we're going and the feedback we're getting, and the patients seem to be really loving it. It's just a great direction that we're moving in.
Absolutely, and talk about something the patients will tell their friends about.
Right, and bring more back to your practice, right?
Exactly.
You'll be the only guys on the block with this type of a product.
Absolutely.